care for the people, we care for the environment, and we care for the world. Nani, 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 oh, Anila, nani. Spread love to your friends and family. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ìmọ́tótó ilé, ìmọ́tótó ara.
I am Sanitarian Awonuga Taiwo Sheffield, the Lagos State President, Environmental Health Officer Association of Nigeria, Lagos State Chapter. Yes, presently we are facing with the issue of gastroenteritis. Gastroenteritis is the inflammation of the mucous membrane, which is caused by fecal-oral infection. And this infection mostly affected the small intestine and eventually leads to vomiting and frequent stooling. These causes of fecal-oral infection, gastroenteritis, majorly embedded with deficiency in environmental sanitation. Their causes are majorly environmental. So if there is lack of environmental sanitation, definitely you get gastroenteritis. If defecating indiscriminately, like what is majorly practiced among people, open defecation. If you are not having good toilets where you channel your excreta, you will be affected with this infection. And the situation whereby you, after visiting toilet, you did not wash your hand, you did not put in personal hygiene practices, we have this infection. Also, if you are the type that doesn't care, eat anywhere and anyhow, you are likely to have the gastroenteritis infection. So even most of us that eat on the roadside, the food vendors that fry akara, pop-off on the roadside, if you do the pop-off and the bean cake that you don't know the sauce, most likely you can get the gastroenteritis. So those are the major area whereby you can get gastroenteritis. I want to say, without missing word, that most of the diseases, be emerging or re-emerging diseases, are majorly caused by poor sanitation. To prevent gastroenteritis, we should discourage open defecation. That's the first one. We should discourage people defecating indiscriminately in an open space. That's what I mean by open defecation. If you can put measures into that, the rate of the infection will be reduced drastically. Secondly, any houses that lack toilet accommodation, sanitary conveniences, they are bound to have gastroenteritis infection, because if your house are not put in order, having good toilets, there is tendency that your tenants or the people or the public will be defecating anywhere they see. And they said nature, you can't control nature. So if nature press you, you have to abide by the pressing of the nature. So also, to prevent, this time around, we need to re-emphasize and emphasize on hand washing. Before visiting, after visiting toilet, ensure you wash your hand very well. Before you handle food, either you visit toilet or don't visit toilet, wash the food thoroughly, wash your hand thoroughly before you handle it. Then you make sure that most of the food that need to be cooked are cooked thoroughly. Then fruits, because most of these fruits, we don't know where they, after harvesting, we don't know where they store them. Maybe they store them very close to the toilet. Before we eat any fruit, we should wash it very well. Then, in the area of our environment, there is need for all our people now to put their houses in order, their premises in order, by providing good toilet accommodation for the use of their tenancy or tenants. And lastly, the area where drainages or canals pass through, people should stop indiscriminate defecation into the waterways or water passage. They should ensure that they go to the comfort station, that means nearby public toilet, to do their defecation rather than going to the stream or to the canal to defecate. So, and then lastly, the water we drink, wherever there is a burst pipe, we should notify the water corporation or nearest environmental health department so that they can call on the water corporation to come and put the burst pipe into perfect condition, so that when people want to consume water, they will not consume contaminated or water that have been mixed with feces to drink or for consumption.
Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ẹ̀fọn tó gbòòrò àtúnlọ́wọ́ àwọn tó rẹ̀rọ. Kẹ́kùlẹ̀ gbọ́ngàn sọ̀fún tókò. Cleanliness is essential. Immortalize your potential. Understand the times and your initial.
The Environmental Health Association of Nigeria, EWON, have been doing a lot, even ever before the outbreak of gastroenteritis. If you could recollect vividly in the year 2012-2013 during the Lassa fever, EWON comes out massively to send Lassa fever away from Lagos. So we are not relenting on our horse. We are still working tirelessly, even to pursue this gastroenteritis out of Lagos. So EWON have been doing wonderfully well. Almost of our officers in their various local governments have embarked on 24-hour services. 2, our people have gone out to intensify more on house-to-house inspection to go and check if there is any houses or housing that are deficient in putting some sanitary conveniences in place, such as toilets. Then, thirdly, our officers have done tremendously by doing some collection of water sample in some affected area and community and taking it to the lab for analysis to confirm the type of gastroenteritis that is affecting the people and the approach to reduce and eliminate the condition. In the area of prevention, EWON will encourage and appeal to the public that wherever they see anybody practicing open defecation, they should not relent in their effort by notifying the nearest local government or SCDA, or if possible the Lagos State government, Ministry of Health or Ministry of Environment. And at the same time, we want to appeal to the public that they should desist from defecation in open places, open spaces, and then they should encourage the habit of making use of public toilet or their own private toilet and putting the toilet in a clean environment. And also, to add to it, we will appeal to them that hand washing should be taken as a priority. After visiting toilet, people should wash their hand properly, very well, before handling of food or fruits. In an ideal society, we should collaborate with each other. That means there should be intersectoral collaboration between the EWON and the Ministry of Health, in which we have been doing, and some other local government and SCDA in the area of eliminating gastroenteritis out of our community. Efforts have been going on, making advocacy educating public on how to prevent gastroenteritis. So, and lastly, my advice to the public is this, that if they see environmental health officer within their domain or community, they should not see them as their enemy. They should embrace them. They should allow them to tell them whatever deficiency they are having in their houses and how to put it in place so that they will live a very good life. Furthermore, I want to advise the public, most especially our landlords, the developers, the agents, those who engage into mortgaging of houses, that whenever they want to build any houses, they should ensure that the toilets are not very close to their source of water supply, be it well, be it borehole, or be it tap borne water. They should allow and maintain the distance of 30 to 100 feet away from where they site their well to the place where they site their toilet, either sock away or pit. So the distance should be maintained in order to prevent underground contamination of water, and this one also will enhance in the prevention of spread of gastroenteritis. I want to advise the government that they should inject more environmental health officers into the system by recruiting more environmental health officers so that they can cope with the volume and the pressure of the job, reducing the rate of infection of diseases. So government should employ more environmental health officers. Like WHO have said that 8,000 population to one environmental health officer. That means one environmental health officer should take care of 8,000 people. But in Lagos State presently, our population is about 23 million, while we are having 357 environmental health officers, which is inadequate. We are shortage of environmental health officers to cope with the gamut of job at hand. So if all this could be looked into, we have a free and fair environment to live in. Thank you. God bless you.
Répétez, balẹ̀, balẹ̀, nulẹ̀, nulẹ̀, fọlẹ̀, fọlẹ̀, répétez.